Hi, I'm Cherie from Epicentre, and today I'm going to show you how to process an antibody test. First thing you need to do is make sure that you read the product insert, because that'll tell you exactly how much blood you need and also how much buffer you need and how long you need to wait before you can read your results. This is the approved South Africa COVID antibody test, and according to the product insert, you need 2 drops of blood, 2 drops of buffer, and you need to wait 10 minutes before you get a result. And I'm going to demonstrate this antibody test on myself. So the first thing you need to do is just check that the product hasn't expired and that it is properly sealed. You then open it. In each packet you should have a pipette, which is what you're going to use to collect the blood, and you should have a test kit. So take an alcohol swab, and if you're obviously testing somebody else, I'm testing myself, you would wear gloves. I always prefer to use the ring finger, and the side of the finger is always best. You break off the top of the pipette, lay the person's finger down on the table, wipe away the first drop of blood. Always bleeds so nicely. And you're wanting 2 drops of blood to place. So you're placing 2 drops of blood, 2 drops of buffer. And then watch as it runs through. Set your timer to 10 minutes. Don't know why I'm bleeding so much today. And add a plaster. And then throw all the items away into your sharps container or into proper waste management. So sharps would go in there, and I'm going to put that into my medical waste container. And then we're really watching to see how the test flows. If it doesn't flow correctly, you can add 1 more drop of buffer if needed. And it should come across, and your control line should come up. And I can see my control line is already up to show that the test is working. And then you wait for 10 minutes to see if you've got antibodies to the coronavirus. This is the control line that shows that the test is correctly. When I opened it, the packet, the line was blue. Now the line is red, which is my control line over there. And you can also see the IgG and the IgM. So if that line comes up, it means I've got a more long-acting antibody, IgG. If that line comes up with the M, means it's much more of a recent infection. And it wouldn't be a bad idea if you have an IgM to also get a COVID test to see if you're still shedding viruses, because you may be.